webinar titled The Top 20 Healthy Workplaces in the World. All participant lines have been placed on mute in order to keep background noise at a minimum. However, we still want to be able to take your questions and interact. So there are two ways to ask a question if you have any of those throughout the session. The first way is to raise your hand using the hand icon on the left side of your toolbar. If you select this icon, I will unmute your audio line and you can ask questions via the phone or your headset. You may also type your question in the question portion of the toolbar and we'll read your question to the group. We'll try to answer as many questions as possible prior to the end of the session. And please note that no portion of the slides should be reproduced without the written express consent of the presenter. This event will offer one ACSM continuing education credit. All participants at your site are eligible to receive the continuing education credit. Following the session, you'll receive an email with the CEC information as well as a brief link to a survey. Please take just a few minutes to complete the survey because we do review those and use them to plan future offerings. As a reminder, this event is being presented by the International Association for Worksite Health Promotion. IAWHP is the first global association dedicated to advancing the global community of worksite health promotion practitioners. And I encourage all of you to learn more about IAWHP and its benefits online at www.iawhp.org. or interact with us online by becoming a fan of our Facebook page or joining our LinkedIn group. Now, let me introduce today's speaker. Wolf Kirsten is founder and president of International Health Consulting based in Tucson, Arizona and Hamburg, Germany. His consulting portfolio is truly global, advising companies on health and well-being strategies such as Johnson & Johnson, IBM, Siemens, and SAP in many regions of the world. He is the immediate past president of the International Association of Worksite Health Promotion and co-founder of the Global Healthy Workplace Awards. We really appreciate Wolf's time and his sharing of his knowledge with all of you today. Wolf?
Yeah, thanks, Heather. Appreciate it. Good afternoon, everybody, or good morning from Tucson, Arizona today. Thanks for joining, and I guess it's still summer here. Definitely here in Tucson, it's pretty hot. So again, thanks for joining. And so today, I would like to talk about good practices and award-winning programs across the globe. And I titled it the Top 20 Healthy Workplaces, and I'll explain how I got to that number, the top 20. So as you can see here in the outline, I will kick it off with a few global trends because I think that's interesting to kind of set the stage what's really going on internationally in the U.S. and outside the U.S. Then look at the Healthy Workplace Framework, which I will explain what that's all about. And that's important because the awards program, which you see here under item 3, is based on these criteria. So that's important to be aware of them and knowledgeable. Then I will flash up the 20 companies, enterprises from different countries, and then take a little closer look at some of the winners and finalists of this year. So there's 6 companies in 3 categories, and I'll explain that. And I actually have a few video clips which hopefully will work. We tested them and everything worked fine. So I think it will be interesting for you to see them speak, and also from a news clip. So to get right into it, you may be familiar with the global survey of health promotion, workplace wellness, and productivity strategies from Buck Consultants, and I've been involved in the survey for probably 5 years now, and it's really the only truly global survey, I would say, or let's put it this way, the most global survey out there in our field. And it looks, or it actually asks employers about their programs. What do they do? How do they do it? Do they evaluate? And so, what kind of programs, what kind of outcomes? So it's a pretty substantial survey, and it's translated into 11 languages, and it's been distributed this year, I think, in 37 countries, over 1,000 employers. So it's fairly large, but obviously there's hundreds of thousands of employers all over the place. I should say any industry can participate. Obviously, any organizational form. So we have multinationals part of this, but we also have small enterprises which only have 10, 15, 20 employees. So it's really all of the above, so to say, and it really gives a good good idea of what's going on, and we see some interesting trends, a lot of similarities, but also a lot of differences. And while this is not the focus of today's webinar, I do want to take a look at or show you two slides reflecting findings from this survey. By the way, it's pretty new. It just came out, the global report. Hopefully you can read this. The font is a little bit weird here, but so this is a question on the objectives. So why do the employers were asked, why are you offering a wellness program? What are you trying to achieve with it? If we go to the way right, to the United States in the column, we see, a little further down, no big surprise, reducing healthcare insurance premium costs. And I think you will all agree that's still the front and center. We hear it everywhere, and especially also with regard to wellness. If you look across that row, all other regions, much further down. And you may know, and you probably know, that the healthcare systems are a lot different in other countries. Many are socialized or nationalized, if you will, more public systems, and the employers do not carry the direct burden of the cost. I would say direct because indirect, of course, they do. So that's why it's not the main issue here, the main goal. So going back up to the first three rows, I would say improving workforce morale and engagement. I thought that was really interesting. Reducing employee absence. And then if you go to the fourth row, improving worker productivity. I'll say something about safety in a minute. So those are really the top areas. Now, of course, there's overlap there. But I thought it's interesting to see that morale and engagement is becoming a huge issue across the globe. As you can see, in most regions, it's very high. And that's related to obviously to stress and mental well-being or lack of well-being. So a lot of employers are struggling with that and want to change it with wellness programs, want to improve it. Of course, productivity and absenteeism have been, over the last 5 years, pretty high, and we've seen some interesting studies on that. And then we should not forget that safety, even through a health and wellness program overall, safety is a key goal, especially in countries where it's still a huge challenge, like in Asia, in Middle East and Africa. So that's a huge challenge still. We should not forget that. And even in the U.S., we definitely have to be on top of that. Going to the second slide here from the global survey, we see here they were asked about health issues. So what kind of health issues are driving your strategy? And what are you addressing with your programs? Stress is number one in overall, and very high in the top three, I think I would say, in most regions of the world. So that is the challenge that we're faced with, and I think we see that coming up very strongly in most regions. It's interesting. In the United States, stress, we all know, what kind of, impact stress has or can have in the workplace. There's a lot of different studies out here in the U.S. too. However, the last 2 years, it was even further down. It was number 6, number 7. So we were wondering about that. Is it just, people, it's been around for a long time and people just deal with it kind of thing? But it's here too. It's creeping up. It's top 3 now, right after physical activity and nutrition. So that's what we're faced with. Again, safety comes up here too as a health issue, just as it was as a business issue. By the way, it should say Middle East and Africa. That second column. That's a mistake here. It's interesting because sticking with that column, in Africa, obviously, if you go further down, HIV/AIDS, is still a huge challenge. However, it's not the top one. It's safety, and work life is also very high. So that's and stress. So we have 3 number 2s, and that's really also a sign of the times in countries in Africa, specifically, especially in South Africa. So that's in terms of the themes which have kind of come out of the survey, and also other reports and surveys out there. Are the following. So the workplace has really become a key setting to fight chronic disease. I think for us in the field, we may think, well, this has been around for a long time. It definitely has in the U.S., I think. But for a lot of countries, this is still relatively new. First of all, chronic disease has been increasing quite a bit, even in developing countries. So it's become more of an issue, more of a problem, obesity, hypertension, and so on. And secondly, the workplace is, I would say, still relatively new as a setting in many countries for a variety of reasons I won't go into right now. But I think this is a positive sign because we all know of the benefits of investing in health at the workplace and the huge opportunity that we have. Keeping an aging workforce healthy, I think that's a global theme. While not every country has that demographic trend as we see in Europe and also in the US and definitely in Japan, it's coming, even in China. So that's going to be a huge challenge in the future because, as we know, aging workforce are less healthy. Rising challenge of excessive stress, lack of morale, engagement, or mental disease. I've made that point clear, I think, in the graphs I just showed. It's interesting, even but in Europe, it's coming up in sick leave. It's showing up as sick leave and disability. It's not the #1 yet, but it's got some big growth rates over the last maybe 2, 3, 5 years. So that's more of a hard indicator where it's showing up. Occupational health and safety, still a major focus for many countries. It's important to emphasize, I think. And growing the value of investing in employee health. People, I think companies are becoming more aware of this and seeing the value more and more. But I think there is a need for more measurement. And this is an interesting slide, which or finding, I should say, which came out of the global survey, which I didn't show, and that is that only half of the respondents answered with a yes to the question, do you measure specific outcomes of your program? So that's not very good, I think. I think we need more than half of this sample size or this sample to measure, basically. So we got some work left there, I'm pretty sure. And then we should not forget about the social responsibility to provide healthy workplaces, which kind of goes beyond just the legislation, keeping it safe and so on. I think that's a factor, kind of thinking attitude maybe, which is coming through. I think more and more companies are seeing that, hearing that, and adhering to it. So that's the other side. That's not the financial side, but it's a social responsibility, and I think companies will hear more and more of that, and consumers demanding it, I think. Okay, so that was just a quick snapshot of the global survey and what's going on globally. And I would like now to move more into, I guess, a model, a more conceptual stage before we get into the awards. So this model comes from the World Health Organization, and some of you may have seen it or heard about it. And it's basically called the Healthy Workplace Framework or Model for Action. And we have 4 areas around the outside here, forming big circles, which kind of comprise a healthy workplace. So you have your physical work environment, you have your psychosocial work environment, your kind of personal health resources and lifestyles, I guess, and then also the enterprise community involvement. That's where this social responsibility comes in, I think. In the center, you have a continual improvement cycle, which I think we're all familiar with and probably agree upon how important that is to know your target group, to assess needs assessment, to plan it and do it, and then obviously evaluate and improve on that. So that's key, but still a lot of programs are not structured that way, unfortunately. And then ethics and values in the very center. I think we shouldn't forget about that. I think that's obviously at the core. And then the importance of having both the leadership visibly and engaged and actively involved, and of course the workers, the employees, from the beginning, that they should be a part of the planning process and not just a recipient of the programs, I think. I think that's really important. This gets a little bit cut off here. I apologize for that. This basically explains what I just said, so it's a little bit busy, the slide, but it explains the 4 areas in terms of health and safety concerns, the psychosocial environment, which includes more work organization and the culture. How do you interact with your peers, your boss, and so on? It's a huge impact on health. The personal health resources, which is more about your, again, your lifestyle, and then of course ways of participating in the community, improving the health of workers, their families, and other members of the community. So that's also part of a healthy workplace. That's not just the core workplace itself. A couple of examples. So, I mean, there's many examples, right? Those programs are very broad, and great programs out there, and some of them we hear about with some innovative ideas. So, for the for the physical work environment, educating and training workers on health and safety hazards and risks, as well as countermeasures, so they develop, health and safety conscience and display responsible behavior. I think there's a lot of good examples out there on companies who are doing this. The psychosocial work environment, an example, analyzing how psychosocial factors are affecting health and productivity, for example, via a survey or interviews, and then applying a team approach to generate solutions. So that's obviously, just touching the surface here. That can become much more in-depth and detailed, but just so you get an idea. Implementing a healthy food policy, which prescribes all cafeterias, vending machines, catered events to offer a majority of healthy foods. And there are quite a few companies which are doing that now. I think especially in the U.S. That's really important, I think, and we've seen some progress on that area. And then the enterprise community involvement circle here, extending advice and assistance to small and medium-sized enterprises regarding creating healthy workplaces. That I think is very interesting, and you will hear in the awards program that we did take a look at that, whether the companies featured or applying, whether they actually not just focused on themselves, but actually were willing to share and maybe even mentor other organizations. Doesn't necessarily have to be small ones, but obviously, or very often, the smaller ones need more help in terms of technical expertise and resources. So, and there's some great examples of companies doing that. Sharing it in larger forums, or maybe even on a kind of one-on-one basis, and I think we need more of that. I think that's really important. Okay, so coming to the awards program itself, I should say up front, otherwise I get into trouble, the World Health Organization is not officially involved in this. They're not endorsing it or affiliated in any way, and I have a disclaimer in here, I think, somewhere. So I think that's really important to point out. We use this program, which I co-founded, the Global Healthy Workplace Awards. You use the criteria, the Healthy Workplace Framework I just explained, because we think they are comprehensive, they are globally universal, globally applicable, relevant, in contrast to many other awards programs that we know which are national, and they're very focused and centric to the country. So that's the big difference here, and as you saw, it's a pretty big area, and it's pretty comprehensive, so it's not easy to do. But we believe that's what it takes to really create a healthy workplace. Just focusing on, let's say, fitness or nutrition we think is not enough. It's good and it's necessary, but it's not enough. You need to look at the larger picture. You need to look at your physical environment. You need to look at psychosocial environment, as I just explained. So that's really important. So we believe in the concept and the framework. So the awards program is now in its third year, and not to go into too much detail, but just to give you a quick overview, we have 3 categories: small and medium-sized enterprises, the SME here, LSE, large enterprises, and the multinational enterprises. So those are the 3 main categories which companies are recognized in. It's really more than a awards program, because we're big on sharing. So as I already said, like sharing the good practice, hopefully that other companies can learn from it and then replicate parts of it, however applicable it is to their own situation, of course. But we've been working hard on that in terms of providing a platform, and also with a seminar program where we've been doing regional seminars in different countries, where we kind of get more into the local issues, because we think that's really important. So, so it really is more than just getting an award, taking a photo, and going home. It's really about sharing and so that the companies, the recognized companies, can share the good stories, but that maybe more importantly that the others learn from it. So I think you will hear that throughout, and obviously doing this webinar is part of that process. So I just wanted to point that out. Just quickly, it's the hosts and partners. My company is International Health Consulting, and I've been working together with a really, really interesting company from the UK called iGenius, and they're really global. They're a world community of social entrepreneurs with members in over 200 countries, and they bring in a very interesting perspective. And a large part of these entrepreneurs, are in the health area, and so they bring a lot of the small enterprises into this program. So I'm really excited about it. And as you can see here, the advisory board, a lot of organizations that you probably are familiar with. Obviously, well, not obviously, but maybe most importantly, the International Association of Works of Health Promotion, which I was just president of the last 2 years. Very, very good to have them on board. We continue to have them on board. The IOE, International Organization of Employers, it's the umbrella organization of all the employer federations out there. So that's really good access to employers across the globe. The IAWHP in American University in Washington, D.C., trusted partner there. And also the European Network for Workplace Health Promotion, also very important to have them on board. And HERO, I think a lot of you know HERO, and we're actually doing a seminar coming up, which I will talk about later very soon. And then two interesting organizations, People in Aid and Catholic Medical Mission Board, and both are big in the NGO world. So we shouldn't forget about all the NGOs out there, non-governmental organizations, which play a big role in promoting health in general, but also at the workplace, and also looking at the health of their employees. Fascinating, I think, because some of these people really work in very difficult circumstances. And they typically have both. They have people working in the regular office jobs, and they have people working in the field. So but that's another story. But very good advisory board, I think. So I think I already mentioned who can apply. Those are kind of the three main groups. We cut off the SMEs at 500. There's different definitions of that. So some even go lower to 250. But we thought we use 500 to give more companies a chance to apply with that employee number. These are basically the 5 keys, which are directly linked to the Healthy Workplace Framework that I mentioned earlier. Leadership, commitment, and engagement, worker involvement, business ethics and legality, sustainability and integration, and following a continuous improvement cycle. Important to mention is that we did add the innovation area or aspect, I should say, and also if the program is somewhat replicable. If it's too specialized in one specific industry or very resource intensive or so, then it probably wouldn't score that high in that category. It's important that, again, that other companies can learn from it and potentially replicate it. So that's a key. I will go through these pretty quickly so we can get to the companies. But these are kind of the questions that have been asked. I think they're actually direct questions from the application under these headings, under these areas. So, how is the organization supporting, implementing, promoting a healthy workplace program? What is the role of senior staff? Do you have a dedicated business policy and a committee? How are the activities integrated? And we give the applicants some flexibility and freedom to write a paragraph. I think it's 500 words per question or per category, I should say. So we don't get 50-page, 100-page application. That's happened as well. So that's important, but we don't do a checklist because I think that wouldn't do it justice, because some companies may just check out everything, and then how do you check that? How do you control that? I mean, it'd be nice to travel to all these places, but it's unrealistic. So anyway, so that's kind of the process. Worker involvement. How are your workers involved in the planning and programming process? Does it promote diversity and gender equality? I think that's important as well. and then kind of outlining how they follow the cycle, and the second point, really important, which processes and outcomes are measured, and what milestones have been achieved. So we obviously want to see outcomes, and these companies have the winners and finalists do, for sure. These are the judges, just so you get an idea. We're very conscious of being global. So it's not just North America and Europe like a lot of international events are, unfortunately. So we have 5 judges from 5 different continents, and they've all done a great job, and we'll be rotating them like every 2 years, I think. So we get some fresh ideas in it, but I want to thank them at this point. They've played a very valuable role in launching this program. So the top 20 here, the drum roll. I divided it up into the categories, so it'd be easier to read anyway, rather than having 20 at once on one screen. But just so you know, this is based on the scores of this year's awards program. And we received, I think around, close to, around 100 from really, 38 or 39 countries, so very, very, diverse and global. And these kind of, the workplaces or the companies that you see here, they made the kind of the final cut. Not the final cut, but I would say they made the shortlist. From these are the SMEs. The small and medium-sized enterprises, as you can see. These companies, from these companies, we invited 2 of them to come to, this year was in Shanghai in China, to the awards summit, or the Global Awards Summit, to present their case study. And basically, they were evaluated. They were evaluated beforehand, but on site, the final verdict was kind of made. Who's going to win it? So they didn't know. 2 of them came and made a presentation, but they didn't know who was going to win. So that kind of is, I think, a nice aspect of the entire program. But basically, these 6 were the strongest from the SME pool, which came in this year for the awards program. And some you may know some. Thai Health Promotion Foundation has been around for a long time and very strong in health promotion, and they actually applied for the program for their own employees, and that's what it is here. I should emphasize, when we talk about healthy workplace, these are programs primarily for your workplace health promotion, so for your own employees. So like a provider or vendor could not apply unless they have a good program for their own employees. So I should emphasize that. All very, very good companies with varying different approaches to a healthy workplace. So pretty interesting. I'm going to move on for the sake of time. The large enterprises, you may know a few companies here. Definitely Vanderbilt University with a very strong application, long history in wellness and health promotion. GE China also had a very strong application. It was their country office who applied, not the multinational overall. And then, as you can see here, from Zimbabwe, was a good one. Another university, Ohio State University, strong applications. It is interesting. We typically receive, I would say, maybe a little more than a handful of really good academic programs. So programs, for their own employees, not like academic programs, but from academic institutions. And not just the U.S., Australia, and other countries. Reliance Industries, I think one of the top programs in India applied, so also very interesting, so they made this cut. And then the multinationals, maybe the most familiar to you, big names here, IBM, Unilever, HP, Hewlett-Packard, Quintiles, another company from Zimbabwe, also very strong, UTC Aerospace Systems, and GE again, GE Healthcare in this case, the healthcare division. So that makes up 20. Really, I would say all really good programs, and I think I don't envy the judges to make their decisions. It's really tough. So again, as I said, what did we do? We invited 2, and here you can see the winners. Actually, I included last year, so just to give you an idea of the companies who actually who won. The bolded ones are the winners here, and the other ones are the runners-up. So some races extremely close. I can tell you about the IBM Unilever face-off this year in China it was nearly too close to call, but one had to win, and then the judges made their decision, and that's what it was. But I think both have exemplary programs, and they've really done a good job because they are both in the multinational category. They do a really good job getting into all these different countries, and as you can imagine, the massive challenges they face, because I mean, they literally are in, I don't say every country, but they are in hundreds of countries. So they're all over Africa, all over Asia, you name it. So just imagine, being faced with that as a responsibility, for those people in charge to keeping your workforce healthy. So, but again, they've been doing it for a while, and nothing happens overnight. I think they do have impressive infrastructures, and they do have resources and all that. So, but a lot of companies do not dedicate their resources to health of their employees. I think we're all still struggling with that. So these are the winners and the runners-up. So what I'd like to do, I'd like to introduce the winners and this year's finalists. So 6 of them, and give you a little flavor, a little idea of what they've been doing. Now, I'm not going to go through this. This is Spokane Regional Health District. Truthfully, before the awards, before the application came in, I didn't know about their program, but was very pleasantly surprised, and obviously the judges were, because they made them the winner. Did an excellent job also presenting their case study, and again, I won't go through all the whole list here, but I will. Let's see if this is going to work here, but we'll get you show you a video clip of their news clip in relation to the awards program, which came out right after.
Well, health is in its name, and it's walking the talk. The Spokane Regional Health District was just honored with being one of the 3 healthiest places, not in the state, not in the country, but in the world. GHWAwards Kelly Cruz live in the studio tonight to tell us what the health district is doing to promote so much wellness at work. And workers at the health district are encouraged to be active. Many work out together during lunch. They go on runs. Yoga classes are also offered, and others get together to do fitness videos. But when they are actually working, yes, they work here, many choose not to sit on a typical desk chair. Employees sit on these fitness balls, and some even stand up for the entire workday, 8 or 9 hours there. And you can even get a little cardio in, responding to emails on this treadmill workstation. I tried it out today. Very cool. As for the vending machine, it isn't filled with the normal.
Oh, there we go. I think, let me see if I can get it going, but if not, then we'll just jump to the next one. I think at least it gives you a flavor of the program.
Well, health is in its name, and it's walking the talk. The Spokane Regional Health District was just honored with being one of the 3 healthiest places, not in the state, not in the country, but in the world. Even stand up for the entire workday, 8 or 9 hours there. And you can even get a little cardio in, responding to emails on this treadmill workstation. I tried it out today. Very cool. As for the vending machine, it isn't filled with the norm. We're talking sodas, candy, and chips. It's filled with things like V8 juice, organic milk, and raisins. And they also have fresh produce, too, for employees to buy. And every day, I like this, is bring your baby to work day. The health district moms are allowed to bring their babies to work until they're 6 months old.
Takes out another element of stress that I think new moms just don't need.
And employees are also encouraged to take the stairs. And the health district is a tobacco-free zone, and that means new employees cannot smoke. Now, these policies are why the health district was just named one of the 3 healthiest workplaces in the world. It is very impressive honor considering companies from 33 countries were vying for the awards. And I think for the rest of the newscast, we need to stay.
All right. So pretty cool, isn't it? It's the local TV station, you know.
It was a swap as you're delivering. Yeah, you think? Nobody wants to see that, believe me.
All right. So there we go. So that's that. So I think it gives you a flavor of the program and all the different activities that they've been doing. They really done a stellar job in providing an environment, a health promoting environment, I guess you can say, and the employees are pretty happy about that. So that's their program, just to give you an idea. The next one is totally different, as you can see here, and it's from Lebanon. And I don't know how much you know about Lebanon, but it's had its problems, I would say. It's not the most peaceful country, I was going to say too. But this company, Technic International, is basically, you know, for automation services for a variety of different industries, including beverage, as you see here. So they work with some of the big multinationals, and you know, I can't speak to their you know, work output, but it seems like they're doing a really good job, and a family-owned business. And the CEO came to London last year, and basically they came in second 2 times in a row. So I feel for them. Again, we have to go by what the judges do and say. But anyway, let's see if this clip works. It's an interview with him right after the London Awards program, and see how that goes here. With his name is Tony Haddad, and again, he's the head of the company, the CEO. Hopefully, it'll load. Okay.
First, I have said to some people, but I'll say it again, the comments I received from the audience, from the people participating, they hearted comments about the program and how inspirational it was for them. For me, that's as good as an award, really, because the award is just the recognition of some achievement you have done, and I think I got it with the recognition of the audience. I think most of the audience thinks that the servant leadership concept is at the basis of everything. You know, for something to happen, has to have a root and a driver. And the servant leadership concept is the driver for all the programs, because after all, to asphalt a road or to do a health program is an effect. It's not really the cause of the thing. It's an effect. It's a consequence of being servant leaders. My message to the people, to the CEOs of the companies, is that you have to start indoctrinating the concept of being a servant leader instead of being a manager dictating and guiding people to do things. Just serve them so that they can serve the customers. If you do that, the rest becomes automatic and it comes by itself. In Lebanon, you have to understand that we've been through 20 years of war. So the company was established in 1982 during the Israeli invasion of Lebanon, and all through the years we've come through chaotic times, ups and downs, wars and everything. It's not easy to operate in Lebanon. It's a small country. Economically, we're not very strong. The government is not supportive, of course, because it doesn't have the funds or the means to do that. So we have to rely on ourselves. That's why the community work that I was preaching, the creating shared value concept, is very important. Enterprises have to do things that the government is not able to do. And it's not easy. It is challenging. And probably these challenges that we have gone through the years of war made it that we are today what we are, because we have an answer for all difficult times. In times of crisis, we react easily.
Okay, I think, yeah.
Well, I guess CEOs think in terms of bottom lines, profit and loss. And as long as they consider this as a responsibility, they will be reluctant to do so. Eventually, this is also as inspirational for me. So far in our programs, we didn't really put too much emphasis on the health of the people. But I realized that to have good achievement and good performance, the people have to feel healthy. healthy, not only psychologically, but even in their physical health. So for us, the CEO has to understand that there's a return on investment for him. He puts money into a health program, and that will be a return for him in the bottom line and the profit and loss. One of the ideas I'm seeing from the forum, from the summit, is that when I go back, I'm planning to have all the team, the 140 people we have in the company, undergo a healthy day, where we bring a doctor and then measure the main KPIs, which is the BMI index, the fat content, the cholesterol level, the diabetes level in the people, and start educating them on being more healthy so that they can live a better life and produce more. We start with the people, and then I think we have to spread it to the community, to the families of the employees, and probably we're thinking in terms of community to run it in the village where we are operating.
Okay, so I think you get the idea, and I think it's really neat to have a CEO, of a company, a small company in this case, make that statement. You don't hear that often, and I think it's really important to provide the stage for, especially for small companies, to share and of course to learn, but to share their programs. And of course they're not perfect, but I think others can learn from it. And Tony Haddad's been a great ally in terms of spreading the word in the Middle East. And again, it's not the easiest region of the world to kind of spread this concept, of a healthy workplace. But he truly believes in it, and I think he's seen the success for his company because of that. Obviously there's many other factors, but I think that's one of them, and that can be very powerful. I think to have people like that be on stage, make that statement, and share their expertise. So we're very glad about that. Just one more word on small and medium-sized enterprise, and then I'll get into the others fairly quickly. It's always hard to get to them, I think, and get their participation, and in this case applications to the awards program. So we're working hard on that because there's companies we've never heard of in countries far away from here. So and they do good work, and may have a little different approach, but they'd be worth highlighting. So I think that's really important to look at the smaller size enterprises. Having said that, I do want to share the other categories. Telefonica in Brazil has been doing this for quite a while as well. Just as you can see here, I'm not going to go through all of these bullets, but you can see here they have a fairly substantial investment. Like 15 medical facilities in Brazilian cities. They have over 100 people working in health promotion and occupational health. So it's fairly substantial, and 40,000 employees. I should say 40,000 lives with employees, dependents, and retirees. 19,000 employees. So that's a fairly sized company, and I try to pick out. We could talk about each of these companies for hours, but try to pick out like at least one or two slides which are kind of interesting or a special part of their story. And I thought this one was pretty powerful in terms of the results. Typical Brazilian company deducts 50% of their workers' payroll for health insurance, so they do have a cost impact as well. And their program and the integrated model, they made it possible to deduct only 7.8%. So there's a direct cost impact here, which they look at it closely. There's other indicators too, of course, but this one I thought was pretty impressive. So it's similar, I guess, to a number of U.S. companies which have been able to kind of bend the curve. This is one of them, Vanderbilt University. These numbers I thought were really impressive in terms of participation. And they have like 3 levels in terms of their HRA, and then HRA plus programs or wellness actions, as they call them, and then a third category is the gold category, where it includes a whole game plan for your health. And I thought 80% is pretty good. If you go all the way to 2013 for the first category, or even I don't know what that number is, but even like 60% or something for the 3. So, again, they've been doing it for a while, but been pretty successful, as you can see, in kind of driving participation over the years. I guess it's, as you can see here, and of course Vanderbilt can respond to that if they get the chance at some point, but you can see here it looks like they've reached somewhat of a plateau in terms of participation, and as you can imagine, it's not easy getting beyond 80%. I think that may be very hard to do to begin with. The results, you've seen these. I won't spend too much time because I'm sure, at least for those of you in the US, have seen these cost trends with other companies like a J&J or so, where they've been successful, have a lower healthcare cost spend than other benchmark companies. So they compare themselves, of course, to others, and they want to try to bend that curve some more. So that was very successful. I will move on to IBM. Now, the global aspect of it, as I indicated earlier, creates a whole new set of challenges, and it's not easy to do. IBM has proclaimed 10 priorities. They have their 4 divisions here, but in health promotion they have, just like in the others, 10 global priorities, and they're very diligent about taking a very close look at each one of these priorities, and then what is the best available program, research, vendor, and then looking at the various sites, and then also making certain elements required for anybody, any company in any site in the world. Some are recommended and others are optional. So they have these 3 categories, and again, I was going to highlight that they're really diligent about finding out what is really kind of the best practice in all these different areas, and then in the various countries, and what resources are out there. Not easy to do, especially in some areas like mental and emotional well-being. As you can see here, it's a broad area, and it's not that easy to find those good practices. Being a big company, they do have a fairly robust structure. This one I like because it shows the team approach. They do have ownership, at corporate. They have a core global team. It really is truly global. This is not driven from the US for sure. And then they have, for each of the priorities on the 3rd level here, they have subject matter experts who are really good and look at specific, the specific issues and make recommendations based on that. And then, of course, they have their local and regional leads who are pretty much in charge of the actual implementation. Nice model, and it's working fairly well for them, and it definitely came through in the application in Shanghai. This is one more from IBM. Being a tech company, the virtual aspect of it does work well. Of course, it's not going to be the only aspect of a program, but I thought this was pretty neat because they did a virtual global health event, which is very big, with live and on-demand access, throughout the world, and kind of interactive booths online in 8 different languages, and it worked really well, and kind of led into their other follow-up programs. So, and kind of a nice, I think, maybe model or to learn from, like in terms of having a virtual health fair. May not be the same as having it on site, but again, that's being all over the world. It's not possible to do that. So this is a very nice experiment, I guess you can say. 2 more, I think, slides on the award winners, and then getting close to ending. This is Unilever. All of you know Unilever, lots of products in the food and beverage industry and so on. I thought this aspect was, again, I'm not doing the whole program justice, but I picked out specific elements which I think are worth highlighting. This is interesting because they have a global standard for mental health and well-being. Not many companies, right now I really don't know of any others who really have a kind of an official company standard. It's not a policy, but a standard. So, as you can see here, resilience in teams and individuals, I think a lot of companies do that, but they go beyond that. The developing line managers to lead and support a culture of resilience and mental well-being. I think the role of the line manager is very important. Easy access to tools, and then of course the people who do experience problems, that they get the excellent care and support. I think that's very important. But again, it's not just reactive; it is proactive. They look at the individual and they look at the environment and how to improve it. So the objectives are around awareness, positive work environment, participation in mental health initiatives, and then the bottom one, maybe even the most important one, the work environment is important to look at that. And if you look at this small graph here, hopefully you can read it. I think it kind of breaks it down. It's very interesting in terms of the work environment. So the individuals are asked about their work environment. So first of all, do you enjoy your job? Maybe the most obvious one. Decision-making ability, role clarity, feedback, recognition, and then the productivity, and then they correlate these things. So those are important. Those are really important, I think, in terms of being a healthy and productive employee at work. And I think more and more companies are doing this. And interestingly, Unilever is doing this globally, and they've made it standard. So a site in, in Vietnam, is supposed to do this. They can't really just say, well, we're not going to do this because we don't believe in it, but it's a global standard, so they're going to have to sooner or later follow that. Okay, just one more from Unilever. I thought this was interesting because it's really overall difficult to calculate an ROI. Can't speak to how they, in these individual countries, how they did that, but for those of you interested, I'm sure you can find out or put you in touch with the relevant appropriate individuals. But I thought I haven't really seen that from other companies do that, like have a kind of a nice overview or dashboard, if you will, of an ROI in these various countries, and breaking it down by healthcare costs, absenteeism, presenteeism, and total. So again, as you can see, they're all pretty good. They're all above the zero line, so that's good. And Pakistan, Egypt, Hungary, countries you usually don't hear about with regard to these numbers. So pretty impressive. Okay, so getting to the end, I don't want to leave some time for questions. This is just next year's event, and I get this question: when do the applications open? It says in the bottom here it opens in January, and there's a window of I think nearly 2 months, 6-7 weeks where companies can apply. But we'll provide more information leading up to it in the fall, and including a few more webinars on how to actually apply. Just wanted to make you aware of the HERO seminar, which is in conjunction with IAWHP, coming next month, where we'll be talking about global wellness, and IBM is one of the case studies there. And I guess that's it. So I'll hand it over to Heather for questions.
Well, thank you, Wolf, for a great presentation. As I shared earlier, we will take questions 2 ways. You can raise your hand using the hand icon on the left side of your toolbar, or you can just type your question in the question portion of the toolbar, and we will read those to Wolf so he can answer them. So the first question, Wolf, that I have is, are there certain specific worksite health promotion programs or initiatives that show high impact that seem to come up consistently among the applicants?
Good question. I think the consistency is really in the process. So I don't see specific program elements which come up necessarily with award-winning programs or successful programs. But one thing is the process. So they assess and they evaluate. So that's maybe the obvious one, but that's important because a lot of companies don't do that. The other one would be that they have a fairly comprehensive approach. So they don't just look at one area, let's say physical activity or nutrition or do your screenings and all that, but they actually look at it from a broader perspective. So I think that's really important to point out. Like, I think those ones which just look at one area don't seem to have the same kind of success. So I would want to say if we want to, or if I would pick out one area where I've seen more focus or development on, and which these companies have done, and that's what I tried to point out with Unilever, is around mental well-being. And I think companies, employers are recognizing that a reactive approach and having your EAP program is just not enough. It's important. You need to have an EAP program. I think can do a lot of good, but you need to be a little bit more proactive around that and look at why are people at work not engaged, why is the morale low, and obviously you can't influence everything, but there are ways to look at that, and it's not all about their home life, that's for sure. So I think that's something coming up more and more.
From earlier in the presentation, a question comes up: what aspects of the work of the WHO framework model generally receive the least focus from most global companies?
Yeah, that's a great question. First of all, we have seen, I've definitely noticed it myself, some a change or maybe progress from even from the first to the second year. Obviously, can't say it's a clear trend just based on this, but I did notice that more of the applicants were actually following the WHO model and trying to hit those 4 areas, and then of course the cycle in the center. So maybe we just communicated better. So there's obviously varying factors, but I did see that trend. And then directly now to your question, I think probably the psychosocial work environment, that one that I was just trying to alluding to with well-being, there's still some unclarity around how to address that. So trying to highlight that with case studies and resources to make sure that companies kind of understand that. I would say that one, or maybe the enterprise community involvement. Maybe the wording the WHO uses for whatever reason, I think is maybe not as advantageous. I mean, most people understand corporate social responsibility. That's not a term the WHO uses. Maybe it's too corporate, too big. But I think being socially responsible as an employer and in relation to health, what does that mean? So those 2 areas I think are not clear enough, or we try to, as I said, try to make it clearer. But that's what I would say. And sometimes, in some applications, companies forget about the physical work environment. Maybe because it's just normal, so to say, or they do it anyway kind of thinking. But they need to outline that too, what they do in that area, because especially in manufacturing settings, that's still a big challenge.
Okay, the next question is there a place online to get case studies or success examples from the winning organizations?
Yes, I would go to the hold on here to the website. Great, which I had at right here. So that's where you would find the award winners and finalists. There's some presentations of their finalist presentations, some profiles. And we're working on that to make it even more user-friendly, and eventually it will be a database, like where you can actually search countries and so on. But that's the place I would go. There's already quite a bit of information on that website in terms of the last 2 years, winners and finalists. So it's at least 12 case studies there.
Great. Well, we're getting near the top of the hour. The last question that I've received so far is, you talked about the importance of outcomes. Are there some methods of reporting outcomes that are considered more favorable than other outcome methods?
Yeah, that's that's $1 million question, isn't it? Again, it's really hard to pinpoint. It would be nice, wouldn't it, to pinpoint it to 1 or 2 specific measures or programs. It really depends a little bit on the country. And then depends on, of course, on the company itself and the corporate culture. But I would say, again, I have to maybe repeating myself here, but it has to be a thorough planning process, a needs assessment process, really knowing who you're trying to address with your programs, who you're trying to reach. and then looking at various strategies how to get to them. And I tell you, incentives is, talking about incentives, because a lot of people believe it's panacea in the U.S. It's not. I'm not putting them down to say they don't work at all, but it's definitely not the all can be the end all be all in terms of definitely not internationally. So of course you want to get to those people, but it's not only about incentives. So I would say a good thorough planning process, and then looking at the various areas that's really the key. And I know it's not easy to do. If you're starting a program, it takes time, and most of these award winners have done it for quite a while, at least planning and so on. So I wish I could give you a more specific answer on that one, but which specific it showed a good ROI. But usually it's a variety of different programs and approaches and strategies which gets to that ROI. And I think most companies will tell you that.
Great. Well, Wolf, once again, we want to thank you. We really appreciate you sharing your expertise with everyone today. Do you have anything else that you'd like to share with the group before we wrap up?
No, basically, well, first of all, thanks again for attending, and feel free to email me if you have any other questions or interested in the awards program. So, yeah, thanks again.
Great. Well, thank you. At this point, this concludes today's webinar. As I said earlier, please watch your email for the CEC and survey information, and also watch your email for future IAWHP webinar events. We hope you enjoyed today's session and enjoy the rest of your day. Thank you.
Thanks.